Gaynor. I know you have great affiliation with Cornell. You've been involved in publication and academic institutions, and I know your wellness center has helped a lot of people. Tell me what's going on in the country. Childhood obesity is on the rise. Diabetes is on the rise. Rate of cancer is on the rise. And every politician claims that they can fix the healthcare by moving things around here and there. But I've always said, without taking care of diabetes, billions of dollars goes into it. Obesity, billions of dollars goes into it. Without fixing our diet, lifestyle changes, and more importantly, behavioral changes, nobody can fix this. What do you say?
You're 100% right on there, David. And the reason you're right on gets to the heart of what my book is about. And it's a new field called epigenetics or ecogenetics, which is the field that studies gene expression. So we all know that we received half our genes from our mother, half from our fathers. But what many people don't know is you may have had a strong family history of cancer, obesity, diabetes, heart disease, but that doesn't mean it has to be your fate, because the expression of genes regulating inflammation and immune function, those are under your control throughout your lifetime, depending on the toxins or the nutrients that you're putting in your body. So people are doing gene therapy on themselves every day for good or for harm, and I want them to do it for good.
Okay, so tell me if I understand it well. Someone has a strong family of cancer, colon cancer, they have breast cancer in the family, they're more prone to get cancer. What are we telling this guy through diet changes? Meaning, like, less fatty food, more healthy diet, more Mediterranean diet. I've talked about Mediterranean diet, that's my favorite. I've talked about all the olive oil, fruits, vegetables, salmon, all the good things that I love because I come from that part of the world. What are we telling this person that comes to your office and you say, you know what, you're genetically a mess. You have all the risk factors, you're destined to die, and now I come to see Dr. Gaynor. What are you going to do? How do you advise them?
Well, when somebody comes to see me, as you know, I'm a medical oncologist. I trained at Cornell. I did my research at Rockefeller University.
And you've taken care of some of my patients, by the way, who are extremely happy with you.
And likewise,
thank you.
Yeah, it's the same. I think we had the same philosophy on that one. But it's a very thorough consultation and really looking at inflammatory markers, immune function markers, but inflammation really gets to the heart of it, because the reason there's such an epidemic of obesity and cancer now, it's been 1 in 3 Americans we're going to hear the words "you have cancer." Now it's going up to 1 in 2 worldwide.
That's right.
50% of the population. And I start the gene therapy plan talking about how autopsy studies of people who died in their 20s, when you look closely, thyroid cancer's found, prostate cancer's found, even in their 20s, but it's dormant.
But you think the source of all of this is inflammation?
Inflammation due to processed foods, fast foods, white sugar, white flour, heat-damaged oils. But the reason those are so bad is those are turning on numerous genes which promote inflammation. Inflammation promotes cancer. It promotes your risk of diabetes, heart disease. It's actually the cause of heart disease. We used to think it was just high cholesterol. Now we know it's inflammation. And so you really have to cool off that inflammation by cooling off the inflammatory genes. And there is a whole plan for doing that, and really simple things people can do.
Okay, so we're